Ashwagandha actually means smells like a horse. So that really is just speaking to the way ashwagandha actually smells. Hello and welcome back. I'm Dr. Carmen, an integrative medical doctor and health coach, helping you fix your period problems naturally. And this is episode 4 of the Period Problems podcast, where we talk all things period problems and hormone health. And in today's episode, we are going to be talking about endometriosis, how your hair products may be increasing your risk of cancer. I'll also be answering one of your burning questions, and our hormone health hub of the week is ashwagandha. So whether you're tuning in here on YouTube or on your favorite podcasting platform, please consider subscribing so that you don't miss out on future episodes. And I hope that you enjoy this one. Period pain is common, but it's not normal. And when period pain gets extreme, then we need to start thinking about what are the potential underlying causes of that extreme pain. And one of the common causes of extreme period pain is endometriosis. So what is endometriosis? Well, the lining of the uterus is called the endometrium. And during every menstrual cycle, the endometrial lining is shed if an egg is not fertilized. This is known as the period. But sometimes that endometrial lining can start to pop up outside of the uterus. And so those cells that are very similar to the lining of the uterus respond to your body's hormones. And so they start to thicken, and they also start to bleed when you are on your period. And because there's no way of these cells exiting the body, they actually just stay where they are and begin to form scar tissue. So these cells that are similar to the lining of the uterus can attach to organs within the pelvis, commonly to the ovaries or the fallopian tubes, or even to the connective tissue that holds the reproductive system in place. These cells can even be found inside the vaginal canal, on the cervix, and they can even attach to the bowel and the bladder. And very rarely endometrial tissue has been found in other places, like in the lungs and even in the brain. It's really unknown what causes endometriosis. And there are a few theories that exist, but really the cause is most likely multifactorial. So there's probably lots of things that contribute to the development of endometriosis. In fact, it's believed that endometriosis begins when you are still in the uterus of your mother. And so there's a theory called retrograde menstruation, where it's believed that instead of the menstrual blood flowing out of the uterus as it normally does in the period, that menstrual fluid could potentially flow backwards through the fallopian tubes and land up in the pelvis. It's also common for people with endometriosis to have immune system conditions. And so there's another theory that perhaps endometriosis is a function of an immune system that is not working optimally. And it's common to find other autoimmune diseases together with endometriosis. Another possibility is that this could develop during surgery. So when you're having a cesarean section, for example, part of your endometrial lining could inadvertently be moved outside of the uterus into the pelvis. Endometriosis also tends to run in families, and so this speaks to a potential genetic component of this condition. But again, it's very difficult to say what actually causes this condition to happen. There are also a few things that may potentially increase your risk of developing endometriosis. Some of these are related to high or excess estrogen, because estrogen really feeds your endometrial tissue and endometrial lining. So some of these risk factors are if you've never had children before, or if you have children really late in life. And this is because when you are pregnant, your body really gets a break from those high estrogen spikes. And progesterone is the dominant hormone during pregnancy. There is estrogen floating around, but it's a different type of estrogen. And so it's believed that if you either don't have children or if you have children really late in life, you're exposed to high levels of estrogen for a longer period of time. and this could potentially increase your risk. Another risk factor would be if you have your period very early in life. So if your period started when you were very young, again, you would have been exposed to estrogen for much longer. Likewise, if you have your menopause really late in life, then you're exposed to estrogen again for a longer period of time. So this exposure to estrogen seems to be one of the things that can increase your risk of developing endometriosis. Also, if your menstrual cycle length is shorter, then you're going to have more periods and more spikes in estrogen than somebody who had a longer menstrual cycle. So if you have short menstrual cycles, this generally will also increase your risk of developing endometriosis. There's also the possible genetic component. So if you have a family member who has been diagnosed with endometriosis, then this could also potentially increase your risk of being diagnosed with this condition. Another potential risk factor is if your anatomy prevents the easy flow of menstrual fluid out of your body. So if, for example, the way your uterus is lying, or maybe if you have certain blockages or occlusions or even scar tissue that prevents the flow of menstrual fluid easily out of your body, this could also potentially increase your risk. So one of the main symptoms of endometriosis is pelvic pain. Now, this is pelvic pain that is independent of the period. You may have pain whether you are menstruating or not. And really, the pain of endometriosis can be excruciating. And for a lot of women, because we kind of think that menstrual pain or pain in general in the pelvis is normal, a lot of women ignore this symptom and think that it's just a normal part of life. But endometriosis pain is really severe pain. So you can have pelvic pain before, during, or after your period. But this pain is really intense. It can cause you to be like curled up in the fetal position on the floor, and it really affects your quality of life. So the cramps and the pain of endometriosis are not normal period pain. And so if you are experiencing severe pain and you don't know why, and you've never been investigated for possibly having endometriosis, I'd strongly suggest that you go and speak to your doctor and explain that your pain is really a lot more intense than it should be. For a lot of us, we normalize period pain, and a lot of women are walking around with endometriosis undiagnosed. And so pain is a common feature in this condition, but it's also not only localized to the pelvis. If you have endometriosis, you can have pain wherever you start to develop your endometriosis lesions. So, for example, you can have pain while urinating if the endometrial tissue is actually sticking to your bladder. You can also have pain when passing stools for the same reason. You can also have pain during intercourse. Also associated with this pelvic pain is lower back pain. And so pain is like one of the most common symptoms in people who struggle with endometriosis. Also, if that tissue is sticking to your bowel, you can have other symptoms related to your bowel. So for example, some people may experience constipation, other people may experience diarrhea. You may have bloating and indigestion, just like a discomfort in your bowel. Again, if you have attachments to your bladder, you may have pain on urination, but you also may have like irritability, needing to go to the toilet frequently. Almost symptoms that are similar to a urinary tract infection. So depending on where the tissue starts to attach, that will also give you clues as to what your symptoms may be. Endometriosis is also the leading cause of infertility. And this is commonly how people actually get their diagnosis. Maybe you've been dealing with period pain and general pelvic pain and bowel symptoms for your whole life, and maybe you've just been pushing through and thinking this is a normal part of life. But now you get to a point where you want to have a baby and it's just not happening. And commonly that's the point where people will go and see a gynecologist to establish why they are struggling to conceive. And so because of these attachments of endometrial tissue to different organs inside the pelvis, it can make it very difficult for you to get pregnant. And so infertility is one of the features of endometriosis. Another symptom is heavy bleeding. And this is probably as a result of the elevated estrogen relative to progesterone. So the idea of estrogen dominance is not one that's generally accepted in allopathic medicine. But what we mean by this is estrogen and progesterone are meant to be in a delicate balance. But if estrogen is overwhelmingly high compared to progesterone, then it may not necessarily mean that you have high estrogen. It may just mean that progesterone is low comparatively to estrogen. I hope that makes sense. So you can still have features of high estrogen even if your estrogen levels are normal. The question is it high relative to progesterone? And really progesterone helps to balance out the effects of estrogen. And so part of the reason why you may have heavy bleeding is that your progesterone levels may be low. And so heavy bleeding, bleeding with clots, and prolonged bleeding is also a feature of endometriosis. So how is endometriosis diagnosed? Well, oftentimes doctors will base their suspicion on the history that you give them. So you may be going to your doctor and telling them that you have this extreme pain, you may be having bowel-related symptoms, and you may be experiencing infertility. So your doctor will take a complete history from you and ask you probing questions to better determine what they think your diagnosis may be. Then your doctor would have to do a pelvic exam, and they may use a speculum to do this as well. And then they'll send you for some tests to be done. Usually the tests could include things like an ultrasound and CT scan or an MRI, just depending on the protocols in your particular country. But the only way to really definitively diagnose endometriosis is by laparoscopy. Now, laparoscopy is a surgical procedure where cameras are actually inserted into the pelvis, they're inserted into the abdomen, and your doctor would have a look around with those cameras to see if they can find any of those collections of that tissue anywhere. And if they do find them, then they'll take a sample of them as a biopsy and send it to the laboratory to check if it is endometrial tissue in that biopsy sample. And that is really how endometriosis is diagnosed. The complications of that is that oftentimes people with endometriosis will go through multiple laparoscopic procedures, and that can actually cause more scarring and more inflammation in the pelvis. And so this is part of the reason why this condition is so difficult to treat, because the cure can sometimes end up causing the problem. And so how is endometriosis treated? Well, typically you would use pain control. So conventionally we would prescribe pain relief in the form of simple pain relievers, anti-inflammatories as well, and just really taper that depending on your level of pain. And then you get hormone-based treatments. Now, you may be put on the oral contraceptive pill, but typically a medication that increases the effect of progesterone in your body would be prescribed. So an example of this would be something like Vizan. And really this progestin medication is prescribed to counteract the effect of high estrogen in your body. And then you get surgery. So like I mentioned earlier, usually laparoscopic surgery is performed for endometriosis. And what would happen is that your doctor would be able to identify that tissue that has been confirmed to be endometriosis, and then they will attempt to remove that tissue. But again, the problem with this is that it could actually end up causing more scar tissue. So what are some of the natural things that you can do to help manage this condition? I'm just going to give you a brief summary, and maybe we can dive into this in a future video. So essentially what we want to do is we want to try and manage the pain, which is a symptom of the condition, but we also want to manage the underlying root cause of the condition. And so first of all, to manage the pain, there are a number of things that you can do to try to relieve pain that don't involve taking pain medication. This could include things like stretching, doing certain exercises, taking anti-inflammatory foods, using anti-inflammatory supplements. You could even start to do things like alternative practices like acupuncture. These can all help to manage your pain and keep them under control. Medical cannabis would be another consideration if you are struggling with endometriosis pain. And in South Africa, we are getting approvals for people to be on medical cannabis for endometriosis. So using cannabis to help with your pain management is something that you can also consider doing. And then on the other hand, how do we address the root cause of the problem? Well, we mentioned genetics, we can't really control that. We also mentioned perhaps there's something physically that could be causing the flow of the menstrual blood to be affected. We also can't control that. But some of the things that we can do are related to how we can begin to bring balance into our hormones to try and minimize the effect of high estrogen. And so a few things that you can consider here are focusing on your gut health. Commonly, people with endometriosis will experience constipation. And if you are not having frequent bowel movements, then your body is going to reabsorb estrogen. So estrogen is actually eliminated from your body in your poop. And so if you are not moving your bowels frequently, you're going to have excess estrogen hanging around in your gut that is just going to be reabsorbed into your body. And so making sure that you're focusing on your gut health, increasing the amount of fiber that you're taking, making sure that you're drinking enough water, that you're having frequent bowel movements, perhaps even getting on a good probiotic, or even making sure that you're starting to implement increasing fermented foods, making sure that you are eating a very nutrient-dense anti-inflammatory diet. All these things will help to support your gut health and help you to eliminate estrogen. You can also do a few things to support your liver function. Again, your liver is actually breaking down and metabolizing your estrogen. And so focusing on making sure that you are not bombarding your liver with things like too many over-the-counter medications, or perhaps even things like alcohol. This will make sure that your liver is focusing on doing the important work of metabolizing estrogen. Also, eliminating toxins from your environment is something that is incredibly important to focus on if you have endometriosis, because we know that there are chemicals in our environment called endocrine disrupting chemicals that affect our body in the same way as estrogen does. And so these chemicals can contribute to our bodies experiencing this excess amount of estrogen compared to progesterone. So check your personal care products, your cosmetics, your makeup, the hair products that you're using. Look at your cleaning products. Make sure that you are not exposing yourself to these endocrine disrupting chemicals, because all these excess chemicals are going to be acting like hormones in your body, and that could be feeding into your condition and making your endometriosis symptoms worse. And then of course, with endometriosis often comes inflammation, and so focusing on really managing your stress can help, because stress fuels inflammation, and also making sure that you get good sleep will help to reduce inflammation. Is your menstrual cycle regular? This can be a very difficult question to answer, and recently I got this question on my TikTok, which says, my cycle is between 34 and 37 days, and just recently I had a 40-day cycle. Is this irregular? And so I thought I'd just dive into this question a little bit more, because it seems to be coming up quite frequently. And there's a lot of confusion around how to know whether your period is regular or not. So firstly, let's just quickly recap the menstrual cycle. So there are different phases of the menstrual cycle. The first phase is the follicular phase. And this is really where your ovaries are starting to mature some follicles. So a few follicles inside your ovaries will begin to mature, and then one follicle will start to mature more than the rest. Now, during the follicular phase, estrogen starts to increase. And this rise in estrogen eventually triggers the release of another hormone called the luteinizing hormone. And luteinizing hormone, also known as LH, is what stimulates ovulation to occur. So eventually, one of those follicles that has matured more than the rest will burst out of the ovary, and that is called ovulation. And so ovulation occurs around about the middle of the cycle, but this can vary depending on your hormone fluctuations and depending on your individual cycle. And so once that egg has been released from the ovary, behind it, it's leaving the corpus luteum, which is like a crater that forms on the surface of the ovary, and it becomes, or it turns into a gland that starts to produce progesterone. And progesterone really is the hormone that supports the lining of the uterus. It's also known as the pregnancy hormone, because if that egg becomes fertilized, then you need high progesterone to make sure that that endometrium stays in place. So progesterone starts to peak at this point, and it reaches its peak around day 21 of your cycle. And then if that egg is not fertilized, then progesterone will begin to crash. And that's actually, that drop of progesterone is actually what causes the lining of the uterus, called the endometrium, to begin to shed. And so typically a normal menstrual cycle is between 21 to 35 days. 21 is a bit on the low side, but there are people who have each and every cycle 21 days, and their period is regular on a 21-day cycle, and so this can be considered normal. 35 days is also pushing the extreme on the other level. So it is a bit of a longer cycle, but typically if you're having your period regularly every 35 days, then this can also be considered normal. Now, how do you know if your period is happening regularly every 35 days, every 21 days? Well, the only way to know is to track your period. Now, this really helps you to be able to determine whether you are having a period around the same amount of days every cycle. And so the first day of your period is day 1 of your cycle. And just to keep it consistent, you can consider day 1 as a full flow before 5 o'clock in the evening. And so if you've had a full flow before 5 o'clock, that's day 1 of your period. And then you'd mark that on a calendar or use a period app. And then after about 3 months or so, you can look back on your tracking and you can be able to count the days in between each day 1. And if those days are pretty consistent, then and they fall between a range of 21 to 35 days, then you can consider your period regular. However, if you are having variation between how many days there are between each day 1 of your cycle, then that is not considered a regular period. But let's go back to the question. This person is actually having a very long menstrual cycle, which is between 34 and 37 days. So certainly 36 days, 37 days between your cycle is not considered normal. And certainly, as they've mentioned, they experienced a 40-day cycle. This gives me the impression that the menstrual cycles are progressively increasing in length. So they're becoming, there's an increasing amount of time steadily between periods. So I would consider this menstrual cycle irregular because firstly, the normal days between the cycle were quite long to begin with, but now there's actually an increase in the amount of days between the periods. And so this would definitely be considered an irregular cycle. So what could be causing this increased length of time between periods? Well, there are a few things to consider. If you are really stressed out, your body is not going to prioritize your menstrual cycle because reproducing is not important when you are under threat. And so stress is a common trigger that negatively affects our menstrual cycle. So if you've been experiencing perhaps a really important life-changing event, or there's something really big that has been causing you a lot of tension, anxiety, stress, then this could be influencing the change in your menstrual cycle. The other things to consider are you eating enough? So there's a condition called hypothalamic amenorrhea, which is where the period completely disappears when you're not eating enough food. So you're not getting enough nutrition. Now, your body is so intelligent. It knows that if you are in a state of starvation, then you shouldn't be reproducing because you need to keep all your reserves to yourself. And so your body shuts down your menstrual cycle in order to make sure that you don't get pregnant and increase the demand on your body. And so not eating enough food can actually trigger a change in your menstrual cycle. And then it's important to consider age, because if you're under the age of 45, then this could actually indicate a condition like polycystic ovarian syndrome, which is one of the most common causes of these long menstrual cycles. Also, if you are ill, your body's priority would be to get you well. And so all your reserves and your resources are going to be focused on making sure that you get better. And again, your body will begin to shut down your reproductive system because it knows that your priority is not reproducing and having babies in this moment. Your priority is actually getting well. And then there's a few considerations if you are over the age of 45. So of course, menopause or perimenopause is a consideration. Menopause really just means that your period has stopped for a duration of 12 months. And so when you're leading up to the menopause, what can start to happen is you can start to see this increasing length of time between each period. And the other consideration is thyroid disease. So diseases of the thyroid can affect the period as well. And so it would be important to get a few tests done just to be able to drill down and find out what could be potentially causing this increased length of menstrual cycles. And there's a few tests that can be done to better clarify what could potentially be causing this. So it would be important, of course, as always, to do a pregnancy test. This is one of the most overlooked tests that are obviously very important in women of childbearing age. But pregnancy test just to give us an idea as to whether changes in the period are as a result of a pregnancy. Then you would want to do your hormone panel, and typically we would want to see the fluctuation or the level of your hormones on day 3 of your cycle. You'd also want to do your insulin level. This is going to be helpful if you're suspecting polycystic ovarian syndrome. A thyroid function panel is also important to make sure that you're ruling out thyroid disease. And then other tests like DHEAS and sex hormone binding globulin, which will also help us better clarify whether this is potentially PCOS. So if you are having an irregular period, then it's very important that you speak to your healthcare provider and find out why, so that you can get to the root cause and fix your period. Is your hair routine putting you at increased risk of cancer? A few days ago, Tamika Smith filed a lawsuit against L'Oreal and 5 other cosmetics companies, claiming that the treatments that she used to relax her hair were to blame for her endometriosis, uterine cancer, and her subsequent hysterectomy. Tamika is from Illinois, and she began using hair relaxers from the age of 10 and continued to do so until the age of 39, when she was diagnosed with cancer of the uterus. 2 months after receiving her diagnosis, she had to have a hysterectomy. She claims that the chemicals in hair relaxers like Dark and Lovely, Just For Me, and Cantu Shea Butter Relaxer are to blame for her illnesses. These chemicals are also known as endocrine disrupting chemicals, and they can enter into your bloodstream via your skin. So either through direct absorption, or if you've ever had a relaxer before, you know how much it burns. So that irritation to the top level of your skin makes it vulnerable to absorb the chemicals that are inside the relaxer cream. And unfortunately, these chemicals, endocrine disrupting chemicals, will disrupt our own body's endocrine system and will actually cause hormone imbalance, which can make us vulnerable to especially hormone-driven illnesses like fibroids, endometriosis, and certain cancers like breast cancer and cancer of the uterus. Now, relaxer was discovered kind of incidentally by a gentleman by the name of Mr. Garrett Augustus Morgan Sr. in the year 1909. Now, he had a tailor shop and he was working on the sewing machines in his shop, and he realized that the needles in the sewing machines would get so hot that they would end up burning the fabric that he was trying to sew. So he came up with this chemical to help to protect the fabric from getting burned. And it worked well. But what he realized is that not only was this chemical helping to protect the fabric, it actually made the fabric become smoother once it was applied. And so he had a theory that if this particular product that he made would work to smooth out fabric, then maybe it could also work to smooth out hair. And so he tried the cream that he made from this product and he put it on his neighbor's dog, and it straightened the dog's hair. And so then he tried it on his own hair and it also straightened his hair. And so then he began to package and bottle the relaxer cream and he sold it to African Americans. And he developed his very own hair refining company called G.A. Morgan Hair Refining Company. So a big problem with relaxers is that the ingredients that are contained in them are often highly toxic. And what's worse is that because the cosmetics industry is not well regulated, companies can add chemicals that could be potentially harmful and either not disclose that those chemicals are in there, or a very popular thing to do is to group these chemicals under the name fragrance. And this way, companies can actually hide chemicals and not disclose them to you. And so Tamika Smith is not the first to bring up a complaint against cosmetics companies because of getting sick after using their products. There are multiple different lawsuits against these particular companies because they promote these products to African American women or women of color, and they fail to disclose how harmful these chemicals actually are. And the problem with the term fragrance also is that oftentimes the word fragrance or the chemicals inside the fragrance composition are used to mask nasty smells and deodorize the product so that they appear or smell less toxic than they actually are. So women like Tamika are aiming to hold companies accountable for failing to disclose these hazardous chemicals in their products. Now, there is a lot of research around the link between chemical relaxers and certain conditions such as fibroids and certain cancers. I'll link a few of the articles in the description below so you can have a look at them in your own time. But ultimately, researchers have warned that the chemicals in hair relaxers can result in uterine cancer, breast cancer, and other hormone-related illnesses. In fact, compared to women who never use these products, women who frequently use chemical relaxers have an approximately 3 times higher risk of developing cancer of the uterus. Another study showed that women who use chemical relaxers or hair straighteners once every 5 to 8 weeks had a 30% higher risk of breast cancer than those who did not regularly use hair straighteners. And interestingly, African American women who reported to use permanent hair dyes were at 60% higher risk of developing breast cancer compared to Caucasian women who frequently used permanent hair dyes. And so when I shared this information for the first time, I got a few questions. One of the questions that kept coming up is, what about keratin? And so I'm going to link a video where I show you how to do a bit of research into your product. And you can really do this for any type of product. It doesn't have to be specifically a hair product. But I was using the Environmental Working Group's Skin Deep website to really do some deep diving into what is in the keratin treatments, and you can do this for any product, including your hair products or relaxers that you want to look at. But the most striking thing that I found when looking into this is that the problem with keratin treatments is that they don't only contain keratin. There are other chemicals contained within the treatment, and often formaldehyde is added into these products, and formaldehyde is extremely toxic, and it's a known carcinogen. And formaldehyde is actually also present in hair straighteners. So it's very important to know exactly what it is that you are putting on your hair, on your skin, so that you can become more aware about what the potential risks are. And so if you ask me, I would say stay far away from these products. The risk of potentially developing cancer, to me, is not worth what your hair looks like. I just feel from a medical perspective that there's no comparison. Having seen many people with cancer, and I'm sure you know of people yourself that have dealt with this condition, you may have dealt with it yourself. It is not an easy road to walk. And if you look at the fact that you could be potentially increasing your risk by so much just by using these products, my question is it worth it? And so this is by no means meant to be judgmental or meant to be instructional, like stop doing this immediately, but honestly, these products are dangerous, and it is important for you to be aware of that. But if you are still not convinced, I would highly encourage you to do your own research. Get your products. You know which products your hairdresser uses on your hair, or which products you use on your hair at home. So grab those products, have a look at the labels, and do your research. Find out what is in the products that you are using, because putting yourself at risk unnecessarily or without knowing is one thing. But once you are informed, then you can make an informed decision. And so if you are in a position where you feel like you have done your research, you've seen the data out there, you know what the potential risks are, and you choose to continue using these products on your hair, then that is your choice. But ultimately, my concern is that a lot of people are not aware of the risks that are involved with a lot of these products. And the data is, there's so much information out there. And nowadays we have access to information, so we can educate and empower ourselves. And so I would strongly encourage you to do that. I would strongly encourage you to really look at your personal care routine as a whole, because it could potentially be the thing that is putting you at risk for a bunch of diseases, but especially for hormone-related illnesses. And so a question came up about which chemicals should you be looking out for in your relaxer products. And really, formaldehyde is probably one of the most toxic chemicals that could be in your relaxer. But other things like phthalates and parabens and fragrance are important to look out for. Our hormone health herb of the week is ashwagandha. Ashwagandha actually means smells like a horse. So that really is just speaking to the way ashwagandha actually smells. But ashwagandha is also referred to as Indian ginseng and winter cherry. The leaves and the roots of this plant can be used for medicinal purposes. And ashwagandha is really known as an adaptogen. Now, adaptogen is basically a herb that helps your body adapt to stress. And so this is why ashwagandha is so awesome for hormone health. When you get stressed out, your body begins to release stress hormones, and that's really as a result of the brain communicating with your adrenal glands. Now, cortisol is an example of a stress hormone, and cortisol gets a bad rap, but we actually need cortisol. It's vitally important for a lot of our metabolic functioning. But if we are constantly stressed out, then this can have a negative impact on our bodies, and it can throw a host of things out of balance, including our hormones. And so adaptogens like ashwagandha are very helpful for trying to restore balance into our bodies, also known as homeostasis. Now let's face it, we all live in a very stressful world, so avoiding stress is something that is virtually impossible to do. But ashwagandha is a very nourishing, grounding herb that can really help you to manage and deal with physical stress as well as emotional or mental stress. And because of the way it helps to soothe and calm and reduce stress, it also can help to improve high blood pressure. It can help to also stabilize blood sugar. It can even reduce your cholesterol level. So for example, if you have PCOS and you have insulin resistance, then in addition to making certain dietary changes, you can add ashwagandha as a supplement. Also, if you have adrenal PCOS, this is really the PCOS that develops as an abnormal stress response, then ashwagandha can be really helpful for bringing back homeostasis and bringing back balance and helping to reduce that excessive fight or flight response that is triggering and perpetuating your PCOS symptoms. But ashwagandha is really valuable in a variety of different conditions, and that's because it is anti-inflammatory. It contains antioxidants, including the master antioxidant, glutathione. And so we know that chronic illness has a lot of roots in chronic inflammation. We need inflammation in the short term, but chronic, ongoing, long-term inflammation is toxic for your body. And really it's at the root of many chronic illnesses. So ashwagandha is really powerful for its anti-inflammatory properties. In addition, it also helps to support your immune system function. And it also helps you to get a good night's sleep. So because of that, it can also have other knock-on effects for improving blood sugar balance and helping you to feel less anxious, less stressed out. In fact, there has been at least one study that compared ashwagandha to an antidepressant and found that it could produce similar results. So because of its effect on your emotional and your mental well-being, it can also help to balance mood and help to uplift you and help you to feel more emotionally supported. There are a few precautions to keep in mind. Ashwagandha can increase your thyroid function. So if you have a low functioning thyroid, then that would be a good thing. But if your thyroid is over-functioning, so if you have a hyperactive thyroid, then taking ashwagandha could worsen your thyroid activity. So if you've been diagnosed with any thyroid illness, I would definitely recommend speaking to your healthcare practitioner before supplementing with ashwagandha. Another important note is that ashwagandha is not recommended during pregnancy and breastfeeding, and it's also a nightshade. So similar to tomatoes and eggplant and peppers, it grows at night. And so if you have a nightshade allergy, then you don't want to take ashwagandha. If you live in South Africa and you're looking for a brand of ashwagandha, then I would highly recommend this one by Soaring Free Plants. It comes in capsule form and each capsule contains 500 milligrams of ashwagandha. The recommended dose is between 500 milligrams and 2 grams a day, depending on what you're using the ashwagandha for. The reason why I love this brand is because it is vegan, so they're veggie caps, and they're also non-GMO. It's medicinal food grade, it's pesticide free, 100% natural, and it's conveniently in a capsule form, so it makes it easy for me to take the supplement every day, because if you're like me, I really don't like taking tablets and supplements. So I'll leave a link for this in the description box below. Our hormone health tip of the week is to eat liver-loving foods. Now we're going to get into what those are in a second, but why is this important? Why should you care about your liver health? Well, your liver is vitally important to your hormone health because your liver is the powerhouse that breaks down and metabolizes estrogen. And so it's super important to make sure that we are supporting our liver as much as possible because we live in a very toxic world. Our food is toxic, our air is toxic, our water is toxic, the products that we use on our bodies are toxic. It's so scary. So our liver really does need our help. And so you may be wondering if focusing on your liver health is something that you need to do. And I'm going to say if you have a liver, then you need to focus on your liver health. But there are a few scenarios where focusing on your liver health becomes even more important. And this would be, for example, if you are taking lots of medication, whether that is prescription medication, whether you're taking a lot of over-the-counter medication for whatever reason, whether you're on thyroid medication, on the birth control pill, your liver is having to metabolize and break down all of those drugs. And so if you are on prescription medication, then supporting your liver health is vital. If you experience PMS, then this is another reason for you to focus on your liver health. So if you've been having breast tenderness, intense cravings, moodiness, especially like the week or two before your period, then focusing on your liver health is going to be important for you as well. Remember that your liver is making sure that your body's hormones are in balance. And so we need to give it all the help it needs in order to make sure that we are not experiencing what's known as estrogen dominance. And typically if you're having PMS symptoms, it's likely that your estrogen is high relative to progesterone. And so focusing on your liver health if you have PMS is super important. It also helps to focus on your liver health if you have allergy symptoms, so itchy skin or eyes or hay fever. Also, if you are somebody who experiences headaches all the time, so headaches and migraines, or even if you experience brain fog and difficulty concentrating, then showing your liver some extra love is going to be important. And also if you are drinking the drinks. So alcohol is really going to feed into estrogen dominance. So it's going to increase the effect of estrogen on your body, and your liver is responsible for metabolizing and breaking down alcohol. So if you are drinking every week, or if you have more than 2 or 3 drinks in one day, then aside from cutting down your alcohol intake to support your hormone health, it is going to be vitally important for you to focus on supporting your liver and eating these liver-loving foods. And I would aim to eat these foods every day. So at least one of these foods every day should be included in your diet. If you can eat more than that every day, then it's even better. So what are some of these liver-loving foods that I'm talking about? Well, cruciferous vegetables are a big group of vegetables that are fantastic for your liver health. And this includes vegetables like cauliflower, cabbage, Brussels sprouts, kale, spinach, rocket or arugula. All these vegetables that fall into the cruciferous family are going to be fantastic for supporting your liver in performing its functions. Other liver-loving foods, that's a bit of a tongue twister, liver-loving foods. Other liver-loving foods include things like beetroot, dandelion root tea, garlic, onions, grapefruit, green tea, green leafy vegetables, turmeric, artichokes, and carrots. So pick your favorites out of these foods and make sure that you're eating them every single day to support your liver in doing the incredible work that it does to balance your hormones. Thank you so much for tuning in to this episode. Go ahead and watch this video on your screen next, because this is the one that YouTube thinks that you should watch. And if you aren't already, please go ahead and subscribe, and I'll see you in the next episode. Bye.